Good night. And tonight we're coming to you from Decatur, Georgia, 1524 La Vista Drive, Decatur, Georgia. And we're giving you a brief video on sickle cell anemia, which is a major part of the sickle cell disease. Now, in sickle cell anemia, what we have is the red blood cells, RBC, taking on a sickle shape or crescent shape. And throughout the blood system, what we have is a lot of these crescent shape or abnormal sickle cell erythrocytes, a normal shape erythrocytes or red blood cell, saturating the blood transport system and blocking and altering the oxygen transport and absorption. Now, suppose this is a normal red blood cell, and this is normal hemoglobin, which is a constituent of the red blood cell, hemoglobin. Then what we have is an abnormal hemoglobin, or hemoglobin sickle. And this hemoglobin sickle causes now the normal red blood cells to take on this sickle shape or crescent shape. And throughout the blood system now, you'd have a lot of these normal erythrocytes or red blood cells taking on this sickle shape, and they become very sticky. And throughout the blood vessels, they would sort of block the oxygen flow and block the part of the blood flow and affecting the oxygen absorption. Yeah, so once again, we have in sickle cell anemia, these red blood cells taking on the form of this sickle shape. And we have, in a sense, the normal hemoglobin and abnormal hemoglobin, which cause the sickle, the cells to take on the sickle shape. And here we have in the blood vessels now, the sickle shape in the blood vessel, blocking the blood flow and causing the sickle cell anemia or sickle cell disease. Now, major symptom in this sickle cell disease or sickle cell anemia would be hypoxemia, dehydration, and severe pain in the joint, the chest, the abdomen, or the part of the body. They affect the immune system, causing a bacterial infection in infants, in pediatric cases, a lot of bacterial infection, which would cause antibiotics to be given in order to combat this bacterial infection. It could cause blindness, it could cause many other forms of malignancy throughout the body. And since this sickle cell anemia is a major cause of pain and major cause of ill health to the body, to both young people, babies and adults, it behooves us that we should find a cure for this sickle cell anemia or sickle cell disease. However, so far there is no absolute cure for this sickle cell disease or sickle cell anemia. But effective treatment has been found in bone marrow transplant, and in other cases, what has been done is that the sickle cells are removed from the transport system. Yeah, the sickle cells are removed, and normal blood is pumped back into the transport system. However, this is not an easy procedure, and when it's done effective, the bone marrow transplant and this is by far the two best method of the sickle cell treatment. Now we have our OMAX microscope here in the background, and if we take slides of a person with blood slides of a person with sickle cell anemia, we would be able to see these sickle-shaped red blood cells being differentiated from normal blood cells throughout the blood system. Yes, we'll be able to detect the sickle. And when the blood system is saturated now with these sickle shape or abnormal red blood cell, then sickle cell anemia takes place. Now, like I said, we went over some of the symptoms, which is pain, irritability, swelling in the hands and feet. Sometimes there's dyspnea, swelling, joint pain, chest pain, pain in the abdomen. The immune system is also affected. It could lead up to bacterial infection. And it could lead up to other complications. And once again, bone marrow transplant is one of the cure for this sickle cell anemia, and removal of the sickle cell from the blood and normal blood pumped back into the bloodstream of the person with sickle cell anemia. But we'll be looking at other abnormalities in the blood. White blood cell abnormality, in which the count, white blood cell count is abnormal. Platelets count, abnormal platelets count, and or thrombin, thrombocytes. Leukocytes is white blood cells, erythrocytes. We're looking at stem cells, and other abnormal microcomponents of the blood. And in effect, we'll be looking at also over who could normalize these abnormalities and so restore health to the body or the body system. So this is just a short video on the sickle cell anemia, abbreviated SCA, and otherwise sickle cell, the disease, which is a wider version of the sickle cell anemia. However, the sickle cell anemia is a major part of the sickle cell disease. So we'll take a short break and we'll return with other abnormalities, blood abnormalities, and how to normalize these blood abnormalities or malignancies.